Hey, Dr. Christianson here with you. Let's talk about the misuse of thyroid medications. The misuse of thyroid medications. This is a big topic. So, thyroid medications, these are among the most top prescribed medications worldwide. Like the top 40 top pop hits that go out, they update those lists, right? Casey Kasem. And so there's the same thing in pharmacology. They do a top 200 list of most widely prescribed medications each year. And there was some weirdness around the pandemic, of course. But barring that, for the last many decades, thyroid meds have been pretty solidly in the top three worldwide. So imagine you drive by a pharmacy, like you go by a CVS, a Walgreens, whatever. Somewhere around half of the cars there represent people getting thyroid medication. So there's a lot. Now, there's two more wrinkles to add to this. So one wrinkle is that it's been shown that when these meds are prescribed unnecessarily, there's drawbacks, there's harm, there's risks. Recently there was a study showing that now we know even when they're prescribed in reasonable doses and people have stable blood levels, there's a higher risk of osteoporosis. They cause more bone loss. We can add to that list higher mortality, higher rate of about 15 different kinds of cancers. So they're widely prescribed. There can be some drawbacks to them, of course, but the question then is, but if they're helpful, if they're needed, could they justify all of that? Well, here's the third wrinkle. So the current evidence suggests that for about 85 or 90% of those to whom thyroid medications are prescribed, they're probably not going to be helpful. So medications always have side effects, everything does, and it's always a cost benefit analysis. If the benefit is worth the cost, so be it. There are a tiny number of people who will be trapped in a burning car because of the seatbelt, but that's unusual. There's way more people to where the seatbelt saves their lives. And that's how we think about any treatment that we do as well. But if there's not a net benefit, then any side effects that are there really can't be justified. Now, 85, 90%, those are big numbers. So here's a hard thing to square. There's many people, you might be one of them, who have gone on overall treatment protocols that included thyroid meds, and they were helpful. Maybe not completely, maybe not long term, but it seemed there was some degree of benefit. So how can we say they don't help if they often seem to help? Well, that's our topic. Let's dive into this and unpack this. And of course, also talk about what can help, what is relevant. And before I get too much further, I really want to own the fact that these are things I've changed my mind about over the years. I've been a prescriber of thyroid meds for over 28 years now. And for about 20 years, that was what I did full time, was prescribe and manage thyroid medications. Now, there were many, many times in which I would see that they were helpful parts of treatment. But here's the tough thing, and this is a big challenge I like to put out to healthcare practitioners and also healthcare consumers. We know what we experience. No one can take that away from us. We know if we do something and it helps us or not. But, we don't always know why things helped or which part of what we did helped. That's the drawback. In the real world, when someone sees a doctor, they generally go on multiple things at once. They're especially in natural medicine. You're given medication, you're given dietary guidance, you're given some support, some validation, some explanation for what's happening, some hope. These are all powerful things. And then on top of that, many symptoms get better and worse on their own schedule. When you lump all of that together, you can be completely accurate about what you're experiencing and about how your symptoms have changed and evolved and when they got better, when they got worse. You can be completely accurate on that. But we can't accurately gauge why. That's the tough thing. And that's where research helps us. Now, research is never perfect. There's always shortcomings, there's always biases, but with it, we can look at isolated variables. We can see how one variable works all by itself. So we got to add in one more concept, and that's levels of thyroid disease. So thyroid disease occurs in a couple different ways. There's diseases of the function of the thyroid, of the structure of it, of inflammation. We're going to focus in on thyroid function right now. So how much hormone is it making? And we're going to focus on the hypothyroidism side, when there's too little hormone coming out. So hypothyroidism can be thought of in three distinct stages. First off is where there's an amount of hormone made that's still laboratory normal, but perhaps not ideal. I call this suboptimal. Many argue that the TSH should be low normal. There's a lot of valid cases where that's true. Some argue about T3 needing to be high or reverse T3 needing to be low. So there's a lot of ways in which some doctors may look at a lab range and say that's normal but not optimal. And then also some will say forget about labs if someone has thyroid symptoms, that's meaningful. So let's call all of that stuff suboptimal. Okay, so there's not really an overt measurable abnormality, but something's not ideal. So that's here. Then we've got what's called subclinical hypothyroidism. Now, this is specifically defined as an elevated TSH, but T4 is still being made. There's still a normal amount of T4. It could be low normal, it could even be a little bit low, but by and large, there's a lot of it being made still. Then the third thing we've got is called overt hypothyroidism. In this case, the TSH is elevated generally by a lot. We could see it up by 20, up to 20, 50, 100 or so. And the T4 levels are low, not subtly low, oftentimes way below range, sometimes barely measurable. Now, this last one, this is really the only one that's a lack of thyroid hormones. Think about this. This is where thyroid hormones are now not being made. With subclinical, the TSH is higher, but T4, T3, we could talk about ratios, ideal, but they're still there, right? They're still being made by and large. So in that sense, those are not really hypothyroidism. And then suboptimal, that can be real. There's a lot of ways you can have normal labs, but still have symptoms, still have problems. But the hormones are there. You guys see the difference? So the thing we've learned now, and this came from a couple of big studies starting in about 2018. There was a large one from the British Medical Journal, a big follow-up in the Journal of the American Medical Association. Together, they encompassed just about 500,000 people over about a decade. And what they showed was that those who have suboptimal or subclinical hypothyroidism, and they're put on medication. And this looked at adults under 65 and over 65. And the questions were, did medications, when they're the only variable, do they improve classic hypothyroid symptoms? Fatigue, weight gain, mood changes, things like this, quality of life. Did they improve health outcomes? Did they lower risks for heart disease or diabetes or other problems? Did they lower the rate of progressing to worse thyroid disease? Did they cut the risk of going to overt hypothyroidism? Did they live longer? Did they do better? So all those questions were put forth, and it was comparing people who had these suboptimal, subclinical levels who were put on medication against relatively identical peers who were not put on medication. And the overwhelming consensus from all of the analysis was that the meds didn't help. So the side effects, the harms that I alluded to, they were real. They were showing up. But there was no net benefit when medication was the only variable. And this is big. This is massive. So how can that be? What about those who feel like they are benefiting? Well, the only thing we can take away from this is that the many cases in which people in those categories go on medication and seem to feel better in some ways is because they were doing other treatments, or they got better randomly, or their symptoms were caused by other things that were either identified and taken care of, got better on their own, or other facets of their care was improving all of that. And that's the thing. In natural medicine especially, no one just goes on a medication. That would be horrible practice. People are given nutrients, dietary change, lifestyle changes, all the rest. And I think for so many years, a lot of us in natural medicine were quick to discount how much those other things helped versus how much this prescription medication was helpful. We saw it all together, and we would often argue that, sure, it's working as a whole, but when you take apart the pieces, you can't do that in the clinical setting. You can't evaluate things in those ways. That's only what can be done when a single variable is tracked in research. And when that's done, all of a sudden, the benefit to the medications seem to vanish. That's the biggest outcome by far, and that was very clear. So what are the solutions here? Well, for starters, if someone is not on thyroid medications, the thought is to be clear on who needs them and who doesn't. Those who have suboptimal hypothyroidism, meaning that they're normal but not optimal, I'd also include those who have thyroid antibodies. So we've got clear measurements of elevated thyroglobulin, thyroid peroxidase. those are real issues. That's what we call Hashimoto's. That can cause symptoms, that can cause disease risks, but meds don't help with that. Subclinical hypothyroidism. Meds can completely improve the scores. No debate about that. You can push around the numbers. No debate about that. But when you look at the outcomes, they're not improved, and there are harms from that. So the symptoms, when we want to manage those, we want to do that by being aware of Hashimoto's and then taking steps to help the antibodies. Iodine regulation can do that. The other big driver of symptoms is what I call the comorbidities. And these are simply other health conditions that are really common in those with thyroid disease. There's a bunch of those. I've got other blogs and videos that talk about that. But the stats are that most people with thyroid disease have multiple other conditions. So latent iron depletion, fatty liver, glucose dysregulation, parathyroid disease, inflammatory bowel disease. There's about 15 common conditions that often overlap. And this is a matter of really just identifying what else is wrong and taking care of that as well. And the thing is, you can get better. It's really a matter of knowing that there are solutions. Your body can improve, the symptoms can resolve. So don't assume that just because there's no other answers or because you're symptomatic and not found solutions yet, that changes the likelihood of medications helping. Now, the other big wrinkle is, what about those who are already on medications? What can they do? Well, it's smart to work with someone to figure out if you still need medication. Even in those cases of subclinical overt hypothyroidism that are more progressed, that are further along, there's a lot of data saying how for about a third of people, they go away just randomly, meaning you do nothing, but you retest your thyroid scores a few months later, and now those levels are fine. So what that means is that if you were put on medication, you wouldn't know that. You'll always stay in a medicated range, and you can't really see how your body works by itself. So the only way to know if you still need medication is to work with a doctor who's skilled in deprescribing. They can work to adjust, lower, taper medication, work with you to see how you're responding, how your scores are responding, and figure out if you still need any or if you still need as much. And by doing that, you can then get to where your body has the best chance to work by itself again and have still good control of symptoms, but also benefits towards long-term health and less need for reliance upon medication and testing and adjusting and all of that. So this is a whole discussion about misuse of thyroid medications. If this may apply to you, please consider studying further. I've got some detailed blogs that talk about deprescribing that are out there. I've trained many doctors through the Endocrine Association of Naturopathic Physicians. You can take a look at endoanp.org, find some naturopathic endocrinologists in your area, and I've got a few opportunities for consulting with people directly. Take a look at scheduledrc.com for ideas that way, and you can also reach out directly and talk about how you could get some help. All right, Dr. Christianson here with you. Take great care. We'll talk again really soon. Bye-bye.